Here in Nevada, 18% of COVID cases are people over the age of 60. We're exploring how this pandemic is affecting our seniors. That's this week on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstadt and additional supporting sponsors.
COVID-19 has disproportionately affected senior populations across the globe. In an effort to stay safe, many seniors are staying in. Without the ability to grocery shop, food insecurity has become one of the top concerns among our local elderly population. Even before COVID-19, Nevada was one of the top states with the highest senior food insecurity. Over 10% of our senior population was food insecure, and that's before the pandemic. According to data collected by Feeding America, this is not a poverty issue. Over 64% of seniors who require food assistance are above the poverty line. And this food insecurity gap has only been exaggerated by COVID-19. In response, local nonprofits have ramped up their offerings. To discuss the current state of food insecurity among local seniors and their response efforts, we are joined by Steve Schmidt, Chief Operating Officer for Catholic Charities of Southern Nevada, Marcia Blake, Executive Director of Helping Hands of Vegas Valley, and Jeff Duncan, Social Services Chief at the Nevada Aging and Disability Services Division. Marcia, Steve, Jeff, we really appreciate you being on Nevada Week. Thank you so much for being on our show. We talked to each one of you before the show. We were kind of planning this. There's so many issues, so many challenges, so many variables for the senior population right now. And across the board, food insecurity was the main need that you all identified. That might be a surprise for our viewers. It was definitely a surprise for me, considering some of the challenges seniors are going through. And Jeff, I wanted to start with you. Why is food security such a big need right now?
When the pandemic started, asking older adults to stay at home and self-isolate really cut them off from, their traditional way they got nutrition services, congregate meal site, whether they were going to the grocery store on their own behalf. So traditionally, our number one need across the state for our needs assessments is transportation, people to the service health care they need. So when people were asked to self-isolate, that just cut them off with the traditional nutrition services.
Marcia, we mentioned in the intro that food insecurity is not new to Nevada. We're in the top 10 most food insecure state for seniors. So this isn't a new issue, but it seems to be exacerbated by COVID. Can you give us some more context on just how severe this is? What is the demand at your organization since we've seen COVID really strike here?
So before COVID, we were serving about 1,200 clients a month with food services, whether they came to our walk-in pantry or they participated in our home delivered groceries program. We also had at that time about 300 people on our waiting list that were waiting for those services. When COVID hit and we basically cut senior citizens off from all of their nutrition options and asked them to stay home for their own safety, those numbers skyrocketed through the valley. And just at Helping Hands of Vegas Valley, we were helping an additional 1,000 seniors a month with home delivered groceries, with them coming to our pickup pantry if they had access to transportation. That doesn't count the, at least 10 other agencies I can think of off the top of my head that were also dealing with a huge influx of seniors who lost their access to food during this pandemic.
I mean, that's a double the demand. I mean, that's a significant amount of demand. Steve, same question. Are you seeing that same increase? Are you seeing double the numbers from where you were prior to COVID?
We did see that same increase. The week of March 1st, I think our wait list was 371. The week of April 1st, when the governor gave the stay-at-home order, the wait list jumped to over 2,800. Now we've all talked collectively about this. I mean, a lot of that was a fear factor and so forth. And but it was really a credit to Marcia and the other nonprofits in the community to be able to jump and try and meet that need. Our wait list now is down around 500. So but but our numbers also increased. We were delivering about 2,200 a week to 2,200 seniors, and now we're up over 2,400.
So the demand's not necessarily going down. Marcia, are you seeing the similar thing here, that demand is kind of leveling out now?
The demand is leveling out since the governor's been able to take us to phase 2. That has helped a lot of the seniors feel more comfortable going back into the grocery stores. Unfortunately, the congregate meal sites are still not open. A lot of those are our most vulnerable seniors. They rely on that free meal a day and access to that, as well as the socialization for that. So that's where we're still seeing the need, the Meals on Wheels, that prepared meal that they get daily to help sustain them. They're really low income. Most of them lack access to transportation. That we still have that really strong population that has that immediate need. But though we're seeing less of the emergent need of, oh, hey, I need groceries for a month or two to get me through this because there's nothing on the shelves are stocked. I think the nice thing about the pandemic, if you can say something nice about it, is that has really brought forward the needs of senior citizens that were already in this community, but now the community is finally paying attention to that need. We call them the forgotten population. And right now they're not forgotten. And so I think that the need has always been there. Now a lot of them know where to go and feel more comfortable in asking for help. I think the pandemic has helped them feel like it's not it's not a bad thing or a shameful thing to ask for help when help is needed.
That's a great point, Jeff. I wanted to maybe talk about that a little bit more on the state side, the entire state here, that perspective of where the need is. And I mean, are we seeing more seniors then reaching out because maybe there's a shift in paradigm here of being able to ask for support, being more aware of what resources we have related to food insecurity or other senior services here?
Yeah, I'd like to make sure I mention here that, we did have the initial influx of people reaching out, and we have stabilized, but we're nowhere close to being out of COVID. Everything that we're doing today is all thanks to our wonderful community partners across the state. Obviously, we're talking Southern Nevada right now, but our entire network of partners have just been fabulous and offering excellent services. So across the state, I wouldn't say Southern Nevada is much different. We are very worried about long-term for our rural and frontier individuals. So I'd say that our other needs, the isolation, the need for socialization, as Marcia mentioned, that many of our congregate sites still are not open, and some, quite frankly, some may not be able to open in anytime in the near future. So we're very concerned about the long-term socialization needs of the older adults as well, and getting transportation, getting the people to come back to the nonprofits and volunteer. Those are big-time concerns for us.
Steve, Marcia, we mentioned fear already is a major factor that might be causing some of the food insecurity. Transportation, of course, is another big one. Are there other ones that you're noticing that are really kind of exacerbating where food insecurity is?
Well, I think those transportation and the ability to get out and get food on their own, is just a highlight of the underlying issues that the senior population is always dealing with. I mean, of the over 600,000, I think in the state of Nevada, senior population, somewhere around 20% are food insecure anyway. I mean, on any day, the vast majority of those are living alone, and I think over 10% are living in poverty, less, somewhere around $230 a week. So, like Marcia's point earlier, just put a highlight on what was already there and just exacerbated that issue. And you get into the whole medical side of this, of which I'm no expert by any means, but just from a nutritional standpoint and maintaining proper nutrition that has become very, very difficult for this population.
Yeah, great point. Let's talk a little bit more then about some of the risks here. I mean, if we don't address some of this, if we're not able to continue to serve a population that is food insecure, what are some of the health risks, the big health risks here that seniors face? Obviously, if you are not getting the nutrition you need, then you are more susceptible potentially to disease. And that's not just exclusive to COVID, of course. Jeff, what are some of the other major health risks that we need to be aware of here with our senior population?
Yeah, I'd say that something we have to consider is our social services and health policy coming together to really look at the quality of life of older adults. So the prevalence of health conditions, people who don't get nutrition, we're going to see that on the increase as well. We have some flexibilities in some of our service delivery, thanks to our community partners, thanks to our federal partners, to really shift some of the, service delivery. And we haven't quite got into that, but Marcia's program, for example, she's really done a good job of switching from traditional pantry services to do shopping on behalf of the older adult. Those are things I think we need to consider in the future as well.
Marcia, yeah, let's talk a little bit about that. We've been talking about seniors and some of the risks here. Let's talk about service providers in general here, the pantries, the food preparers, the delivery services here. You've had to change, of course, your entire model because of all of the challenges that COVID-19 is posing for all of us. Tell us right now, currently, what are some of the biggest challenges that you are confronting?
So within even the last couple of months or even the last month has been access to food, even for food pantries. So the supply chain caused a lot of stress on a lot of food pantries in Southern Nevada because we couldn't get the food to the client. So the same issue they had with going to the grocery store and finding the shelves were empty, we were having that same issue in dealing with wholesalers and the people that we normally work with because their food supply was cut off as well. That started to ease and we're able to get things purchased. But during that time, we had to rethink if this happens again, where does that put us as a food pantry and how do we make sure that we're serving all the people that need to be served? So we've had the opportunity to look at some different models. One is actually using funds to purchase groceries for clients. A lot of our population, they're not technology savvy and also they lack access to technology because of their low income status. Internet is not on the top priority. A lot of them don't use it, but a lot of them can't afford it. And so we're able to go online and purchase groceries for them and have that delivered to their home. That allows them access to that food they need. One of the things that we also find is that with this population is they have restrictive diets due to disease, whether it's diabetes or heart conditions. And so it's not a one size fits all type of a solution. I can't give somebody that needs to be on a low sodium diet stuff that has tons of salt in it. And so that self-selection process is very important to this demographic. We also began working with a company called Tivity, which does prepared meals, and they drop ship the prepared meals. So one of the things that we've run into in our service delivery model is a lack of volunteers. When COVID first happened, we had tons of volunteers, tons of people that wanted to help, which was fantastic. But as the states began to open up, they've gone back to work. The need is still there to have that food delivered and those going on. And so this option to have these shelf-stable, frozen, prepared meals drop ship directly to the client is amazing because I don't have to worry about if the truck can get it from California to Nevada. All I have to do is place an order and they worry about how to get it to the client. So there's a lot of different things. Obviously, we've put into place masks and gloves and distancing to ensure that the population stays safe. But one of the other things that we haven't really yet talked about a lot is that social isolation. A lot of our clients were already socially isolated. Nevada has the highest suicide rate among senior citizens in the nation by double. And now we've taken their congregate meal, their church services, they're going to the casinos, those things that helped them feel like they had a lifeline to the outside world. And that's, we're telling them, hey, if you do that, you could get really sick and die. And so that to me causes them to even go more inward and become more socially isolated, with that additional risk of those mental health issues.
Yeah, and Steve, let's talk a little bit about what Meals on Wheels, the program there, and such a big part of that program, of course, is that personal connection, making the wellness checks, making sure that the seniors that are your clients are getting what they need. How has that changed in kind of this new era here?
Well, as both Jeff and Marcia mentioned, naturally, due to COVID, we have to socially distance, and a big part of we use hired staff as drivers, 8 of them right now to run 8 routes a day, and more than 60% of the people that we serve, our driver will be the only person that they see that day. And now limiting that contact, which is needed. I'm not, it has to be. We don't know what happens behind the door. We can make a kind of visual assessment of the person standing 6 foot away, but so much of what happens in referring to other resources and so forth in the community is found out when they walk into the house. We don't know, if they even have a refrigerator or a freezer that works. We don't know if the house is unkempt, and other visual cues that normally rely on. And unfortunately, I'm fearful of what we're going to find when we do go back into homes, because we do know these most of them are alone and don't have any other supportive structure.
Jeff, let's talk a little bit about that. Let's transition the conversation to solutions here. But I think this is a great point. We're not only the challenges that Steve listed. I'll add to that something we've already talked about, the tech divide here. This isn't something where telemedicine or our checkups, very similar to our virtual conversation right now, can be used as well. At the state level, what kind of strategies are being used, thought about, or employed right now that might mitigate some of this lack of connection that seniors have right now?
I think that's a great question. And we actually have addressed that, not so much from the state perspective. I always have to say kudos to our community partners, but many of our partners across the state have stood up technology options such as purchasing internet and tablets on behalf of the older adults and their caregivers to keep that one-on-one contact going, whether that's wellness checks or whether they're in to see if they need any services, medication, food. So we've seen a huge of our partners asking for funding to really shift that non-face-to-face to a virtual tablet base, whether it's a Kindle, an iPad, or something like that. So that's already in the works, and we anticipate that since we're not going to be over COVID anytime soon, that will continue to be a shift in service delivery.
We're not going to be over COVID anytime soon. Reflective of that is right now we are in a special session. Our state legislation is talking exactly about that, specifically about our budget. In that budget, Jeff, Department of Health and Human Services proposed from the governor $233 million of cuts. Aging disability services is listed in there, receiving cuts. Specifically about food insecurity here, are there risks of any of the funds, any of the supportive programs or the direct programs being cut?
At this point in time, it's really too early in the session to know what's going to happen. Our elected officials have a very tough job in the next couple of days. We do not anticipate any changes to our funding as far as our state funding around nutrition. We know based on COVID, it is now our number one need, and it was already a high need in our system. So we don't anticipate, and we did not put forth any cuts to nutrition services or food security services in our agency budget.
Marcia, special session, what are you advocating for? What are you hoping can be accomplished in just the budget portion of the special session?
As far as the budget goes, I understand that every demographic in the state is going to be affected. It's going to be tragic for the kids, for the older adults, for the disability community. I think the thing that we really have to look at is making the most of what we have. we don't have the power to make those decisions. We elect officials to do that. But as service providers, we're really resilient. We made it through 2008 and 2009 when our city crashed before. We're still here. Catholic Charities is still here. Steve and his team do a fantastic job. They help so many realms of people. They go from birth to death. And so I think us as service providers, the best thing that we can do to advocate is to work with each other. Steve and Jeff and I are on a lot of calls all during the week with some amazing community partners here in Southern Nevada and a great group of people in Northern Nevada. And we have really, really come together through this to provide services throughout the whole entire valley and the whole entire state.
Well, I just like to piggyback on that and say that there's been fabulous collaboration across the state for all of our community partners, but that is the only thing that will get us through this in the future, is that there's obviously not going to be additional funds. So we have to find new strategies to work together to take care of the vulnerable population.
And you read my mind. I wanted to talk a little bit more about that funding. There won't be more funds. Steve, let's talk about the funding so far. The emergency funding, which Catholic Charities has received a considerable amount, but there's a shelf life on that. You're looking forward over the next year where it looks like our food insecurity situation with our senior population isn't going away anytime soon. Do you have enough funding in place to be able to continue with the services that you're providing right now?
Well, I don't think that we're unique in stating as a nonprofit we never have enough funding, but but it is important to note that, particularly with the senior population, everything else aside, but particularly with the senior population, it's only an issue that is going to grow. It's not going to get less. The senior population in our state is growing exponentially, and therefore the need will grow exponentially, particularly in times like this. So, as much as I don't want funding, to go away, because I truly believe, the governor and our legislature understand that a dollar spent on food insecurity is saving them many more dollars on the other end from a medical standpoint, a day in a hospital or a day in a nursing home. So the more we can serve people in a congregate setting, and understanding we can't do that right now, or home delivered meals, it is keeping them out of the hospital and out of a nursing home. So it ends up saving money in the long run. But to Marcia and Jeff's point, the community partnerships, I think, that have developed out of this, we talk regularly about an inherent competition for dollars among nonprofits, but COVID kind of made that all go away and made us realize we have to work together to address this problem and lower barriers, and it has done so from 3 Square to even the food supply coming out of the resort industry that they had left over. The ability to logistically handle that and get it to the doors of people that need it is truly amazing. And it's an amazing story that Las Vegas really rose to the occasion, and Nevada as a whole.
And Steve and Marcia, as you both mentioned, something that could be modeled and replicated across other sectors, other service areas too, in our nonprofit community. Great point. We've got about a minute left, and I wanted to bring up just the public charge here. Of course, we as citizens are restricted on what we can do. We can still give and volunteer and maybe advocate right now. And Marcia, what are the best ways to do that right now in the era of COVID?
So for us at Helping Hands of Vegas Valley, what we're really looking for right now is volunteers. We have a lot of homebound seniors that need groceries and need home delivered meals. The best way for us to distribute those is using volunteers. We have a lot of school teachers that are off for the summer right now, or maybe some people who now have a furlough day that they didn't have before, where they could use that time to give back to the community through volunteerism. I know we do have some people that can't do that, so we're always welcome a generous donation to us or to their favorite nonprofit. There's a lot of us that not only rely on grants, but have relied on a lot of community partnerships and with businesses, and those businesses are hurting as well right now. And so their capacity to give is lessened as well. So anyone in the community, find the way that you want to give back, the way that touches you, the cause that means the most to you, and give of your time and your money both.
So right now we don't have any volunteers on campus. Typically on an average day we have between 200 and 300. So it is we've had to adjust our operations and so forth, naturally so, to keep things safe and secure. One of the creative things that our development and volunteer team has come up with that I told them that I think we needed was for our Meals on Wheels clients just to write them cards and let them know we're thinking about them. And, to deal with that isolation and just notes of encouragement. And so we've already received thousands, from kids and everything else. And I think, what a nice message for seniors to get.
We're out of time, but what a great way to end our conversation. Thank you so much, Steve, Jeff, Marcia. We really appreciate you being on the show.
Thanks for having us.
Thanks, Kim.
Thank you.
Thank you for joining us on this episode of Nevada Week. For any of the resources discussed on today's show, please visit our website at vegaspbs.org/Nevada-week. You can also find us on social media at Nevada Week.